So today we'll be talking about the hip pain pathology and diagnosis, okay? So here I have written down for you all anterior, lateral and posterior. So depending on the patient's complaint, we'll learn how to diagnose. Suppose if the patient is complaining for the anterior part, we'll name it as a true hip pain. If it's in the lateral side, we're going for the bursitis or tendinitis, okay? If they're complaining for the lower back pain or the gluteal region pain, we'll go for referred pain, IT-band syndrome. We'll see how to do a differential diagnosis and we'll come up with the best diagnosis and which are the tests will be efficient for this patient, okay? And according to that, we'll program the exercise. If not, exercise is not working, then we have to go for some other approaches, okay? So now these are the things which I'll give you for anterior, lateral and posterior approach. So the first topic which we will cover in this video is intra-articular hip pathology. So first we'll do the femoral acetabular impingement, okay? What is impingement? A conditions where the abnormal contact occurs between the femoral head and the neck and acetabular rim of the hip joint, usually due to the bony shape changes. So whenever there's a degenerative changes or abnormal, you can say malalignment or misalignment of the joint, it can cause impingement on those muscles and they can refer to this pain, okay? And this repeated impingement can cause damage to the labrum and cartilage and leading to the hip pain and restricted movements, most commonly seen in young active athletes or adults. And this has three types. We call it CAM, pincer, and the last one is a mixed, which combines of both pincer and cams, okay? So this is the definition. So now we'll cover the types. So the first type is your cam type. What is it? A bony bump outgrowth at the femoral head neck junctions. So suppose this is the head of the femur and this is your acetabulum. So there is a small bony growth here, and whenever you do any rotations and stuff, it can cause impingement whenever you're doing the movements, okay? So that's why it causes pain. What is the effect? Instead of being perfectly round, the femoral head is slightly misshaped, okay? That's why it causes a jam whenever you do your flexion or rotation, and that's why it will aggravate the pain. So in this is the cam type. Next is your pincer type. What is it? Excessive coverage of the acetabulum over the femoral head. So whenever you do the movements, now the femoral head is moving. Suppose I'm doing a flexion. So there is an impingement because the acetabulum is covering more of those head. So whatever comes in between, it gets impinged. That's why there's a painful sensation. Okay. So who are the people who gets more often? Most commonly seen in middle-aged females. So females are more common with this second type. Problems: labral degenerations and cartilage wear and tear due to repetitive compression force. In camp was shear force, in here is a compression force, okay? In this third type is your mixed. So most of the patients, they have both in somewhat degrees, the camps and the pincer types, okay? So they'll have. Next is your diagnosis and management. In here we'll do a clinical approach. You have to do a pattern recognition, okay? So you have to do a pain provocation test. Suppose your feather test and hip quadrant test. So these are the two tests to rule out the impingement for now. Okay, other ones we often use the MRI CT scan to see whether there is a bony growth on the joints which is causing impingement in that hip joint. Okay, so conservative methods will be you have to strengthen those deep hip stabilizers muscles, even your hip strength adductor strengthening, and you can see your manual treatments and other approaches. Suppose your dry needling, you have all those things. Whichever approaches you can apply on this. So whenever you're doing the hip pain management, here is the assessment which you have to take note on, okay? First, I'll check for the history. Age of the patients. Suppose they are in the pediatric or adult. And next will be the timing of pain. Whether the pain is constant, whether it is intermittent, whether it is nocturnal. They don't know when the pain is coming or not. If the pain is aggravating while walking and stuff, okay? Or while doing the flexion or external rotation movements. You have to see when they are getting the pain or timing of pain, okay? And the thing now which will rule out is where is the pain located. Suppose if the pain is in the anterior part of the hip, it is the true hip pain. If it's in the lateral part, we'll go for the tendinitis or bursitis, okay? And for posterior, it can be referred from your lower back pain. So in that way we'll go. Suppose I have written down here also. So, and you have to do the special test.